Hello YouTube friends, welcome to another segment of Switch the Script. On this topic, I'll be covering digital markets in the healthcare systems. So we already know that there are more private hospitals than public hospitals. Now my biggest issue with the current system is public hospitals tend to rely on the government a lot. Okay, so some people say, I go to the public hospitals because they don't prioritize profits. I had mentioned this before. Any institution that does not prioritize profit tends to run at a higher cost than the institutions that prioritize profit. If you're not using your profit to sustain yourself, then you'll have to seek that money somewhere. And that somewhere for the public hospitals is the taxpayers' money. Okay, so this may not affect you, but when you start hearing 10 billion was used, or 10 billion or some millions were lost by this public hospital, then yes, you'll see the sense in trying to use the markets to make it to make health services and also medicines cheaper. My biggest issue, first of all, will be the exclusive rights that KEMSA has to public hospitals. That means that private medical suppliers can't get access to these public hospitals, so they have to deal with the high costs that the KEMSA is imposing on them. So if we eliminate that, then we have opened up competition, where if the KEMSA offers lower prices, fine. If the private medical suppliers offer lower prices, well and good. But if the KEMSA, for example, can't keep up with the competition from the private sector, then we'll have to disband it, and we welcome more private medical suppliers. Now, on the issue of hospitals, we have private hospitals, and people have raised the issue that these private hospitals, there's a possibility that they may be taking advantage of their patients. Now my solution will be, let's encourage digital markets. Okay, so when you're going to the supermarket, Naivas, you have all these different prices where you can pick the brand that is cheaper. Maybe you like the brand that has good quality, but you're going to pay more for it, but there are people who will pick it. Okay, so if you're going to introduce a digital market, we need to incentivize them. So maybe a 2% reduction in what you pay in taxes if you're going to enter into this digital market. So all these services that you're offering, put a price tag on it. So any individual maybe had a surgery or needs a surgery, and is wondering which hospital would offer me the lowest price. So I can just go, how many hospitals are within Nairobi? Okay, which one offers me the lowest price? Okay, and which one can do it as soon as possible? Okay, that's the power of a digital market in the healthcare system. We don't have it, and we will be changing the game in the healthcare sector if we will encourage it, but not forcing it. I am not for forcing private hospitals to register their prices on a digital platform. If you're going to do that, let them do that at their own free will. Okay, also when it comes to pharmacies, we have seen there are some e-platforms that are offering medical equipments and also medicines. Okay, and you're seeing that people are going there and looking for the cheapest product. Now if a similar system will be in existence only for healthcare, then I think we will be changing the game for the better. Also, you may be asking, where did you get this information? Where has it worked? Now, go to your Google and look for the Surgery Center of Oklahoma. Okay. Now, this center actually has this a center only for the best surgeons around, and on their platform they have like a human body, an illustration where you can click on different parts of the body, go and look at the different prices that they offer, and the prices that they are offering are the cheapest in the US. And that's the power of the free market that I was talking about. Okay, so the same way that you will go to the market, someone tells you, this apple is 30 shillings, and another one is offering you the same apple, good quality, 20 shillings, you'll go for that one that is 20 shillings. We need that e-platform for healthcare, and I think that will change our healthcare system for the better, rather than trying to mandate draconian policies in the healthcare center, which causes shortages, which also leads to our different people being misdiagnosed and dying from those misdiagnoses, which is really sad, really. So that's my take for today. Till next time.